Frontline workers from St. Luke's and Essentia Health are speaking out, sharing what they experienced during a routine shift amid the global coronavirus pandemic. Now this morning, staff want you to know the surge is here and it's going to take all of us working together to help limit the spread and save our most valuable resources.
This is something that I hope to never see in my career, and I think we're all really passionate about what we do.
St. Luke's ICU nurse Heather Swanson works to save lives.
People are incredibly sick, and seeing these grieving families is sad.
As prepared as she tries to be, Swanson never predicted she'd be using her skills to save dozens of patients diagnosed with an uncontrollable virus.
As I've been talking to my coworkers and physicians and people that we work with, I think this is a time that we're going to remember for our entire career. There's a lot of unknowns.
She spoke with us after working a double shift, taking time from her day off to share an important message for members of the community.
The volume of patients has increased, and that requires us to have a greater number of nurses and staff on, and it's stretching our physicians and our respiratory therapists and all of our staff.
Swanson says they're well equipped with personal protective equipment, but it's simply not enough.
I do feel fortunate. We've got nice respirators that we wear. They do take a toll on our faces, and the bridges of our noses get quite sore by the end of our shift.
She and her colleagues are some of the most at risk for contracting the virus. Recent data shows community spread has spiraled out of control within the counties across northern Minnesota.
I think that all of us at the end of our stretches of work are slightly depressed and frankly a little anxious about what is to come.
Full of anxiety and frankly burnt out, Swanson knows the battle will continue until we all follow mitigation efforts as we wait for a successful vaccine.
I think because this surge has been delayed to reach our region, people have maybe thought of this is just the flu, or this isn't that serious, or it's overblown by the media. That's not the case.
I'll say, personally, this is the only time in my career that I've felt anxiety.
Just up the block, the campus of Essentia Health is also seeing a chaotic scene unfold.
The COVID patients they take a long time to round on because they tend to be really sick, especially when they get into the ICU and they end up on a ventilator. It's mostly elderly folks.
Dr. A.J. Haig works in the critical care and ER at Essentia Health.
I spend a lot of time calling the families and talking to them and giving updates.
Due to visitor restrictions, doctors and nurses are also becoming messengers for family members who anxiously wait for some sign of good news.
Patients are scared. Patients know what the risks are when they get COVID. They know that there's a high chance when they get in the ICU that they may not make it through.
Essentia is currently seeing the largest number of patients requiring ventilators since the start of this pandemic.
Our numbers are increasing, and we are running out of resources, and our biggest resource issue right now is staff.
Similar to the staff at St. Luke's, community transmission of the virus is taking a toll on staffing numbers at Essentia.
It's not easy to find more nurses because they're being pulled in every direction, and everyone is looking for them.
This nationwide shortage of nurses and doctors now hitting close to home as the elderly and those with underlying conditions continue to be the hardest hit by the disease.
It's straining. These patients are really sick. There's a lot of them, and it's going to get worse, and we can feel it at the bedside.
Dr. Haig believes if everyone were to follow new restrictions put in place by Minnesota Governor Tim Walz,
it takes away the joy of the things that we have.
It would help alleviate the strain on healthcare systems.
Other places have not done that.
As hopeful as he is, the reality is proving different.
If we continue on this same trajectory, what I'm really worried about is we're going to get to a point where just about everyone knows someone who has died from COVID.
Both medical professionals agree masks are a simple way to do your part in helping save not only your life, but the life of someone else in our community.
Every one of these people has a life, and they have a husband or a wife or children that are grieving.
As the days drag on, Swanson and Haig will continue to do all they can to save those who end up in their facilities, but ask you to do your part to help limit the spread of this vicious virus.
I don't think that this is going to be our forever. I honestly think that we will see better days ahead, and that's why we all need to be patient and just wear our masks so that we can try to end this quicker.
In Duluth with photojournalist Adam Jaganich.
It's got to be hard for the patients.
Brett Scott, Fox 21 Local News. Dr. Haig says patients who do recover are reporting long-lasting effects on the lungs, heart, kidneys, and brain. He says if we change what's happening locally by improving our behaviors, we can dramatically decrease cases of COVID-19 right here in the Northland.